right corner, there's a woman carrying water. That is, they live in high in mountain in Himalayas, and then from the low base they bring water and by physically, so it's really difficult. And in the downwards to the right end, also there are a few young children, female children. They are carrying water. They are going to fetch water for drinking purpose, and the data says that 10.8 million people in Nepal does not have access to improved sanitation, and about 3.5 million still do not have access to basic water services. So wastewater, it reflects community activities and behavior. So this is a short schematic drawing that I'm trying to give, that how the sewage system is incorporating most of the antibiotics and other pollutants, including from the drugs, including from the pharmaceutical industries and from the industries from food industries like alcohol, tobacco, etc., and pathogens from various sources from human to hospital effluents. So these all goes to the sewage system, and and due to it, the water gets polluted, and again from there we get lots of toxic elements and pathogens, where we get the diseases. So, in short, sewage water is important source of public health information and biomonitoring tool to explore human exposure to pollutants and infectious agents, and surveillance of infectious diseases is also very much important. In, even now, to some extent, there are some few tap waters which is still drinkable, but however, it's getting polluted throughout the country. And when we talk about water quality, the assessment there are in three classes, and that is physical, chemical, and microbiological. So when we talk of physical, it is turbidity, conductivity, color, suspended solids, dissolved and total solids, etc. And when we talk of chemical parameters, there are acidity, hardness, presence of iron, arsenic, ammonia, etc. And in case of microbiological, mostly the organisms which get involved in the polluted water, I'm only talking about these. There are obviously more than other organisms are also present, E. coli, Salmonella, Shigella, etc., and also including Klebsiella and all. So this is the to the to the right, sorry, to the left extreme below. This is the Thap Dam that is present in the high level of the Kathmandu Valley itself, where the water source is the reservoir for the drinking water purposes. And from there till then, it's the water is quite clean. But from there, when it comes to the municipality drinking water distribution and the rivers and the tributaries, then it starts getting polluted due to the human activities. So when we talk of wastewater, it's again that I'm talking about wastewater and drinking water because it is going side by side. That these are the waste water which has been used, and there are other pollutants which has been already incorporated, like most of the time food scraps, oils, soaps, human waste, animal. When we talk about the nature of wastewater, there are pollutants and there is a problem. So solids, these are the pollutants, and it creates a river, because every life which has been in the world is settlement. The human life settlement is always besides rivers or the sources of water. So rivers were always our early highways, but however now the water is becoming polluted. So in Nepal, there has been a river which is going across the Kathmandu Valley. Now I'm coming to the valley itself. So there is a river known as Bagmati River and Vishnumati River. Earlier it used to be quite clean, and it is the heart of the settlement of the Kathmandu Valley. But however, it is getting polluted due to the man-made pollution, sewage treatment. Sewage is not being treated before adding to the rivers. So there should be a very careful surveillance how it has been polluted, and the color of the water is so dark. And in the rainy season, luckily, since Kathmandu Valley is situated in 1500 meters high from the sea level, our ground is quite sloping, so that's why it looks cleaner, though the water is muddy. So wastewater pollutants, there are chemical and microbial pollutants, which I have already talked about. And there are like sections of various types of pathogenic bacteria, antibiotic resistant bacteria, and some carrying resistance genes also, and human viruses, protozoa, helminths, and biotoxins. And when we talk about chemicals, they are mostly the organic pollutants, antibiotics, pesticides, heavy metals from the or, uh, from the human recreation that comes to the water river. So again, when we talk of microbial, it again gives rise to high toxicity and complicated toxicological mechanisms and can pose serious risk to ecosystems and human health even at low concentrations. And this is also regarded by United Nations Environment Program, which is an urgent matter. So it is really necessary to understand the transmission of risk of pathogens, that is the fecal, oral, or airborne droplets, and there should be an study of indication of high risk pathogens circulating in wastewater, an environmental dissemination pattern of AMR, and wastewater based epidemiology to inform public health. Here I'll be talking about a little bit of the pathogenic organisms that is circulating in wastewater, and a little bit about AMR, that is antimicrobial resistance pattern that is present in the wastewater. So this is about 56 years ago, Bagmati River that looks like this. The same area, now this is the settlement, how the development has occurred. But this is, cholera has been an outbreak last year because there had been a flooding due to the heavy rain. But in the winter season, still this is a polluted river. So from Fulbright, there had been a visiting professor, Cheryl Colopy, and she has written a book on this Bagmati River, that dirty sacred rivers means that the once it used to be a sacred river, now due to the pollution it has become dirty. And this is again a little bit smaller river in compared to Bagmati River, which is again a polluted, which I am showing in this figure. It runs down through the Kathmandu Valley. And however, there are 5 municipal wastewater treatment plants, which is though not enough right now. This is the red area which I have marked here are the places where there is a 5 municipal wastewater treatment. And since I've been talking about the presence of resistance antibiotic presence in the river water bodies of Kathmandu Valley, here we know that the human and animals habitats are there, and from household, agriculture, industries, and healthcare, it goes to the wastewater system, from where though there is a wastewater treatment plants, and these have been discharged and receiving water bodies, that is again goes to aquifer, and some of them will get leaching, and some of them it is being used for the irrigation. And from wastewater also there is a water that can be reused, and there is a biosolids that can be reused. However, this ultimately goes to the human and animals through the environment and from the contact base also. So this is how the antibiotic resistant bacteria and the gene, that is the mobile genetic genes, can also transfer within the wastewater, where we can also get it again back to human and animals. There has been a few studies which has been done with the wastewater and with the treated municipal sewage water as well as untreated water also. There has been a work done, and researchers have shown that carbapenem resistant bacteria and carbapenem resistant genes has been present in the wastewater and the river of Bagmati River and Bisnumati River and its tributaries, which is flowing through the Kathmandu Valley and within the Kathmandu Valley. So most of the isolate organism is E. coli, you can see here, and Klebsiella pneumoniae, followed by Pseudomonas, Acinetobacter, and Klebsiella oxytoca. So here we have, it's very surprising to note that in summer and winter season, the organism has been retrieved from the wastewater, but it's been seen that in the case of summer region, it has been high in compared to winter season. So phenotypic and genotypic characteristics of ESBL, extended beta lactamase producing E. coli recovered from various water resources. Here we can see the height that has been shown almost to 80%. And there are antibiotic resistance in wastewater, which is again an alarm to public health. Here, according to this resource, which I have shown you, here in thousands, this has been shown here. That is the death occurred due to AMR in Nepal. That is mostly it is due to Klebsiella pneumoniae, and then followed by, though it is a normal flora it seems, but however Staphylococcus aureus and E. coli, those which is from the fecal oral contamination, is also showing the high rate of the death occurred by the AMR strains. And when we talk about this again, beta lactamase, extended beta lactamase producing bacteria, we can see here that most of the cases here in short also I have given here in the lower caption that we can see that hospital influent and municipality influent, it is showing the high number of the organisms. That is the population of bacteria that has been present. And with the case of MRSA, methicillin resistant Staphylococcus aureus, here the gene that is the penton valentine lucidin gene is been taken in the study, and it has been seen that it's quite, in the case of clinical isolates, it's quite high, and though it comparatively environment studies shows little, but however in the case of ampicillin, that is the antibiotic that we can see that from the environment isolates also we are having lots of number of this in case of PVL gene present in the Staphylococcus aureus. So again with the carbapenes ESBL producing bacteria, the experiment shows, and here are my colleagues who are present in this experiment. They show that there are quite a lot of bacteria which has been present in the antibiotic resistant gene and mobile genetic elements. Here mobile genetic elements are also very much important because it is present in the wastewater, which gives rise to a horizontal transfer to the other bacteria, and from the fecal oral contamination that will come to the animal and humans and cause disease. So again, there is another carbapenemase producing bacteria